Hello, I'm Dr. Amelia Davis. I'm Assistant Professor and Medical Director of the Eating Disorders and Obesity Programs at the University of Florida. And today I'm going to talk a little bit about eating disorder careers, being a physician and working in eating disorders. So just kind of take you through the lecture. I'll talk about how to become an eating disorder physician, licensure, and what exactly do eating disorder physicians do. So in general, the requirements to become a physician are a 4-year degree, either in Bachelor of Arts or Bachelor of Science, and then also there are some pre-medical coursework that one has to complete. Includes 2 semesters of biology, general chemistry, organic chemistry, physics, English, and calculus. Sometimes applicants to medical school will also complete advanced degrees like master's and PhD to kind of help when applying to medical school, but this is not a requirement. Also, the MCAT is a standardized test, part of the admissions process. So after completing the undergraduate coursework, one has to go to medical school, which is a 4-year program. The first 2 years are in basic sciences, and the coursework is in biochemistry, human anatomy, histology, human development, physiology, neurosciences, pathology, microbiology, pharmacology. And so once a student completes the first 2 years and all that coursework, then they take the USMLE Step 1, which covers the first 2 years. And in order to go on with training, they have to pass that exam. So then it's the 3rd and 4th years, which are the clinical rotations, where students rotate between surgery, obstetrics and gynecology, family medicine, internal medicine, pediatrics, and psychiatry. Others may also rotate, depending on the medical school, in neurology, radiology, anesthesiology. So it varies from different programs. Typically the 4th year is more elective time. If one is interested in a certain field, spending more time in that field, or also a lot of interviews for residency occur then. So usually your last year you take the Step 2 exam, which has both one part that's multiple choice tests, basic testing over your knowledge about medicine, and then also another part is a clinical skills exam where you interview standardized patients in a variety of different settings. And so also one has to pass both of those exams in order to progress to residency. So in order to practice medicine, one needs to complete residency, which varies in length depending on the specialty. So either 3 years for family medicine, for instance, 3 years for emergency medicine, psychiatry is 4 years. And so it varies, and during residency you are working directly with patients. You work under supervision of an attending physician who supervises your work and has the final responsibility for the patient care. But again, you're kind of directly working with patients and able to take care of patients, which is great. So after your first year of residency, you can take the Step 3 exam, which again is kind of going over is an exam about basic medical knowledge. And after passing this exam, then one can apply for medical licensure, which is within your state, or you can apply within a different state. And this is required to practice in each state. So with a Florida medical license, I may not be able to practice in Georgia. Depends on the rules of the state. I think at the VA you can hold one state license and practice across the country, but in general. After completion of residency, then one is able to take an exam within your specialty and become what's called board certified. So you have to complete the 4 years of residency, and then they have an opportunity to take an exam once a year, and you can kind of testing your knowledge about that specific field. And this is not required in order to practice, or in general it's not required to practice medicine. However, it makes you more marketable and holds you to certain ethical standards, and it in general makes you more, like I said, available for different job opportunities. So in terms of becoming an eating disorders physician, there are different ways that you can go about this. In terms of there are fellowship programs across the country. Usually those are within, these are psychiatrists who have completed residency, and then they do another year of fellowship. Also, other practitioners and physicians will kind of work in the field and may work closely with practitioners who are trained in eating disorders. These can be either psychiatrists or family medicine physicians. I think most physicians who treat eating disorders are psychiatrists, but definitely the having an internal medicine background or family medicine background is helpful in managing the care of this patient population. In addition, as many eating disorders begin in adolescence, having a background in child and adolescent psychiatry is also very helpful. And so sometimes individuals choose to do a fellowship in child and adolescent psychiatry, which adds an extra year to your training. So there's also some certifications that are available to kind of show that one has specific knowledge about treating and evaluating eating disorder patients. One is the CEDS, C-E-D-S, and it's provided by the IDEP Foundation, which is the International Association of Eating Disorder Professionals. And this certification is for nutritionists, therapists, and physicians, and kind of helps show basically there's a minimum requirement for how many hours of work that you've done, about 2 years, and having under supervision of someone who's trained in eating disorders. And also you have to successfully pass a written exam in the field, and kind of encourages members to kind of stay abreast with current development and continuing education. So, in general, what do eating disorder physicians do? They work in a variety of different treatment facilities, settings. So from inpatient, where patients are there, 24 hours a day, to residential treatment facilities, which are most of the day, but at night will stay outside the facility. Partial hospitalization programs, which is less intense, and then intensive outpatient programs, which are typically about 3 hours a day, a few days a week, to outpatient treatment, which is seeing someone either once a week or once a month, depending on whether you're doing psychotherapy or medication management. And then, of course, there's private practice, and there's also academic settings. So a wide variety of settings, and often people will decide to work in a combination of things. It's also, as an eating disorder physician, it's important to collaborate with others. Working as a treatment team is very important and central to treating this patient population. So you work with dietitian, therapists, case managers, and also the patient and the patient family. And then what kind of things do eating disorder physicians do? Well, typically they're helping lead a multidisciplinary team of professionals. Like I said, nutritionists, therapists, nurses, case managers. Also, sometimes one is prescribing medications, doing psychotherapy, individual therapy, or group therapy. They'll typically perform a physical exam and review the labs and monitor for refeeding syndrome. Often will help determine the level of care that's needed, whether it be inpatient versus whether someone can be treated as an outpatient basis. And also a lot of part of it is providing education to the patients, families, and the community. And one additional thing is the psychiatry, you can, an eating disorder physician can either be a psychiatrist or a family medicine practitioner. Sometimes the psychiatrist will help manage a lot of the medical issue or medical aspects of the disorder. Other times they'll also collaborate with a family medicine physician. It kind of depends on either the treatment program, what's available, what kind of resources are available. There have also been family medicine practitioners or either pediatricians or internal medicine physicians who have kind of chosen, are interested in eating disorders and work with eating disorder patients either because of their interest or their a lack of other resources in a certain area. So overall, going back through the lecture, being an eating disorder physician is a great field, great opportunity. One can, it's very interesting in that you can, you get to work with interesting patient cases that are often complex. It's an expanding field where there's a lot of new research, so it's very exciting. It's one where you are constantly learning new ideas and new things. You get to work with other healthcare professionals on a team, really get to be a leader of that team. So it's really exciting, and a lot of the patients are very appreciative of the work that you do, and so at the end of the day you feel good about what you've done. And thank you.